Well, when it comes to rural hospitals and the whole rural healthcare delivery system, obviously over 20% of America lives in rural areas, so that's always very important to us. I guess the most immediate issue that is before us is getting several expiring provisions extended that are riding on this government funding bill at the moment. But the other big issue is really the implementation of the $50 billion Rural Transformation Fund that was part of the big bill that passed recently, H.R. 1, the reconciliation bill.
There's mixed feelings, to be honest, because it's a nice gesture by the federal government to provide funding. At the same time, the One Big Beautiful Bill also cut $1 trillion of Medicaid funding. And so this $50 billion doesn't even come close to making up for what they cut. The other thing that's difficult about it is there's a lot of restrictions on the way the funding can be used. The guidance from the federal government, from CMS, gives states until November 5th, which is not very long, to write an application and submit it to CMS for how they plan to use this funding for the next 5 years.
And states are in the process now of having to file applications to get their share of that $50 billion amount.
The state has created 4 different work groups, each focused on a different area of the grant application that the state wants to prioritize. The number one thing that the hospitals and clinics are interested in utilizing the funding is for workforce recruitment and retention. The whole idea of this grant is to transform rural healthcare and make it more sustainable financially, provide better quality. So we have a real challenge ahead of us.